So how did you begin your work with the homeless community?
So I started working with the homeless population about 5 years ago through an organization called Doctors Without Walls. We provide free health care for anyone who can't access it, and a big chunk of that patient population is the homeless. So I realized through that work that people who are struggling with unstable housing generally don't have access to health care, but they also don't have access to things like counseling and food and clothing and very basic necessities that are kind of required to move on with your life and end homelessness. So they're stuck. And that experience really taught me the value of meeting someone and trying to figure out what are the problems that are keeping them there, and then systematically addressing each one of them, moving towards either stable housing, employment, or both.
Okay, so what organizations are you affiliated with?
I'm affiliated with Santa Barbara Community Physical Rehabilitation, which provides free physical therapy for anyone who can't access it. That could mean homeless, no medical insurance, underinsured, or can't afford treatment. I also am involved in the Central Coast Collaborative on Homelessness, and what that means is we try to get all the different service providers for the homeless, meaning nonprofits, county organizations, to work better together to provide service. So it's a lot of making the system more efficient. And formerly, I was involved in two nonprofits, one called Common Ground Santa Barbara County, where I was the team leader for a case management group called the Milpas Project, and another one called the Downtown Project. And also Doctors Without Walls, Santa Barbara Street Medicine. I was their clinic coordinator and provided free health care on the streets for people.
So give us a glimpse, like what does your average day look like? So what do you do in a day?
Yeah, so here at the physical therapy clinic, what we do is see people who are having trouble with movement-related issues. So if you have a broken ankle and need to get it moving better, if you have a hip replacement, a knee replacement, a stroke, anything like that, our goal is to help you move better, which eventually leads to things like housing and work, and just being able to physically move enables you to do those things. So we have volunteers that come in, either physical therapists or doctors, and a bunch of physical therapy aides to our students. And what we do is provide anything from exercise education to exercise to kind of expert evaluations for neurological problems. Is it too loud? Okay. We see about 7 patients a day on average. It varies between like 4 and 10. And we come in 3 days a week, first thing in the morning, 9 a.m. to noon, and just exercise with them. And yeah.
All right, so can you give me like a specific example of your story of one of the lives that have been impacted by any of the services, either past or present, that you've provided, or like any colleagues or anybody that you've seen that have been really impacted?
Yeah, I'd like to talk about one of the first people I ever met, actually, who was living on the street. His name is Robert, and he was about 70-something years old when I met him. He was living in a park in downtown Santa Barbara, had been there for 20 or 30 years, very, very long time. When I first met him, I was trying to give him socks, clean socks. And he wanted nothing to do with it and just told me to get the hell out of there. I was like, all right. And then I kept coming back, and kind of the same response for a really long time. Just kind of like a mean version of a grandfather, this old white guy, just really angry all the time. And he was living in the park, and he had his friends that hung out with him. It was like his kind of a street family, but I didn't know much about him. And one day he got sicker than usual, and he went to the hospital, and I got a phone call from the hospital saying, hey, there's this guy who says he knows you and wants you to come pick him up and bring him back to the park. I'm like, okay, that's odd. He's never said more than 3 words to me, but all right. So I go out there, pick him up from the hospital, bring him back to the park, and we just started talking, and I realized that he had a really, really hard life. He was a Vietnam veteran. He was drafted, went to Vietnam, came back with just really severe psychological trauma. He was physically disabled from that as well. But he overcame that, and he got married and had a family. He had children in the South. He worked as a construction worker. He was doing pretty well. And then when he was about in his 40s, his wife died of cancer. Really quickly, really unexpectedly. His children were adults at that point, and they were kind of able to take care of themselves, and so he found himself alone. And his wife had been in his support system for a very long time and really kept him upright, gave him a reason to get out of bed every day. And when she was gone, his self-worth and his drive to live just vanished. A slow, painful spiral later, he ends up homeless. He lost his job, lost his house, lost basically everything. His kids were gone, off doing their own thing, and he just didn't have the drive to do anything about it, to change himself. So what happened was he ends up on the street, and he was suffering from his Vietnam-related trauma. He was mentally ill. He was in pain. He was drinking to self-medicate, because at that point in time there wasn't health care for the homeless. He didn't have any money. He couldn't afford health care. He definitely couldn't afford mental health care, like a psychologist or any kind of counseling. That wasn't going to happen. So he drank, and he drank, and he drank, and he drank, and he ended up with heart failure and diabetes and all the things we see from chronic alcoholism. And he's dealing with that living outside. He's trying to find a support system of people who are around him that's very dysfunctional, but for him it's all he had, so he clung to it. Anyway, fast forward, he's out of the hospital, he's ill, he's not doing well, he's back in the parks, and for some reason, he picked me as the one to open up to. And people have been trying for years to get this guy to talk, and he just shut him down, and he really brought me and told me about his family, his history, everything he was going through. And through a collaborative effort with a lot of different organizations, including the homeless shelter here in town, we convinced him to leave the park and come give the shelter a try. That process in the shelter back to the park happened about 4 or 5 times. He was really uncomfortable in the shelter because it's a hard place to live. It's different than what he'd gotten used to. Regardless of his health or not, that was his normal, was living on the street with people he knew, and he's in the shelter. And so I would meet him here every day and hang out with him, and take him to lunch once in a while and just give him some kind of interaction. He kept getting sicker and sicker and sicker, and then eventually we got permanent housing for him through a partnership with the City Housing Authority. They were just amazing and kind of put him to the top of a list. We got him a place. And so all of a sudden, for the first time in about probably 30 years, if not longer, this guy had a place to live of his own. He could lock the door behind him at night. His stuff was safe. He had a place to go that was his. He had his own things, and that's such a profound place for someone to be in life who had so much taken away from them. And that was really amazing. I helped him move in. I was there on move-in day. I used my car and we loaded everything up, and it was just such a mess, but we got him in there. And I helped him clean, and we did a run to Kmart and bought a bunch of dishes and Tupperware, and he was just doing great. I still went to visit him every couple days just to say what's up and hang out. He kept getting sicker. He wouldn't open the door until I had knocked for 5 or 6 minutes. He wouldn't answer his phone anymore. He was very visibly ill and weak. And at one point I went over there and he was saying his legs were swollen up, he was short of breath, he was really, really ill. And I said, "Do you want to go to the hospital?" No. He always called me boy. "No, boy, I don't want to go to the hospital." It's like, "Okay, well, can I bring a doctor to you?" Fine. So I call a doctor friend of mine, we come over, and he had a history of heart failure from the alcoholism. And she said, "Robert, if you don't stop drinking and go to the hospital, you're gonna die. Not next year, like in the next few days probably." He said, "All right." Not meaning he wanted to go to the hospital, meaning he understood. So a couple days went by, I kept checking in on him, and then I was here actually working at the physical therapy clinic, and I got a phone call from the manager of the housing complex, and I just knew. I answered it. He had died in his sleep the night before. And I went over there, and I had a lot of mixed feelings. I just got him a TV. He was really happy about that. And I saw that sitting in the box still. And I spent some time with him, with the body before they moved it. And as hard as it was to see him pass and to be around for that process, I think honestly where he was in life after so long of homelessness and all the trauma with his family and disease and living on the street and just all in Vietnam, I mean everything that had just compounded his life and made it really painful. At the very end, he had the dignity of dying in his own house. He was in his own bed, and it was painful. It was painless. He was asleep. That's the best possible outcome that could have happened. At that point in his life, just having the basic dignity of being able to die the way you want, on his own terms, not in the hospital, not full of tubes, not being worked on. He was tired of that. And he got that, and I think it's largely in part to the fact that a lot of our neighborhood organizations worked together very well that time. I was his biggest advocate, but I couldn't have done it without the housing authority and the shelter's cooperation and the medical team's cooperation. Everyone had to kind of bend the rules a little bit, and we gave this really disabled Vietnam veteran who did a lot in life. He raised a great family, he fought for his country, he did all these great things. We gave him kind of the best exit we possibly could, and that was a big deal.
So one last question here. Have you had any or experienced any in your time working with the homeless at all? Have you had any, not opposition, but like dealt with any like clashing forces or just complications with either law enforcement or medical professionals or things like that have just complicated your efforts or made things more difficult?
The politics of homelessness are complicated. There's a lot of issues. There's, from a larger perspective, the actual politicians are being pushed in either direction to support the homeless from the more liberal side of things, and a lot of the people in town with services and healthcare and housing and things like that.